Hello everyone, and welcome to this presentation entitled Building a Supportive Ecosystem for Disease Prevention Programs, What Can Be Learned from Coordination and Financing Mechanisms During the COVID-19 Pandemic. This presentation will be done by myself, Colleen, previously working at the London School of Hygiene and Tropical Medicine. This study was undertaken by researchers at the London School of Hygiene and Tropical Medicine and Emory University with the support of the COVID-19 Hygiene Hub and the Global WASH Cluster. This specific work was undertaken in the context of the COVID-19 pandemic, which emerged as an unprecedented outbreak and humanitarian crisis. At the onset of the crisis, response programs mostly focused on the promotion of preventative behaviors, including hand washing with soap, physical distancing, mask wearing, and later on, vaccinating. The unparalleled scale of outbreak posed new challenges to the increased number of actors, especially in the WASH community, involved in prevention programs, especially in terms of coordination and financing. In this context, this study was designed to understand how factors related to coordination, program financing, and information management contributed to the design, delivery, and quality of COVID-19 prevention programs. More specifically, we aimed to identify common challenges and opportunities across settings to improve the architecture of the supportive ecosystem surrounding disease prevention. The broader objective of this work is to contribute to resilience building beyond COVID-19 and to adaptations of the humanitarian responses to public health emergencies. This infographics summarizes what we understand as an ecosystem for humanitarian programming. It is a mix of stakeholders, processes, and tools. They all affect each other and contribute to the implementation of effective and efficient outbreak and humanitarian response programs to protect people in humanitarian crisis. For this work, we decided to focus on coordination, financing, and information management because the emergence of those systems is relatively new and mostly based on experience responding to previous crises. Few evidence is available in terms of challenges and opportunities faced by those systems. Since October 2020, we have conducted in-depth interviews with participants from 4 target groups. First, individuals involved in managing humanitarian and outbreak coordination mechanisms. Second, with representatives of organizations participating in those mechanisms. Third, with donor agencies funding humanitarian and outbreak responses. And finally, with organizations receiving this funding for COVID-19 prevention. In total, 57 interviews were conducted remotely in English or French, with participants based in over 30 countries. Data was coded with declarative and indicative codes and thematically analyzed. The result will be presented according to those 4 target groups, starting with coordination and then financing. Only the most important findings are presented in the following slide. According to individuals who were involved in managing coordination mechanisms, which were mostly WASH cluster coordinators in the study, coordination mechanism was strong in leading needs assessment and mappings, in providing technical guidance, and managing and disseminating information. Many coordination mechanisms use COVID-19 specific task force and working groups. They increase the frequency of meetings and use new online tools for their tribes to quickly and successfully disseminate information and share evolving guidelines. However, other processes such as monitoring and evaluation, emergency preparedness, and contingency planning were more difficult to implement during the pandemic. Most coordination mechanisms also highlighted that the adoption of remote coordination processes created both challenges and opportunities. Opportunities included the expansion of membership to coordination mechanisms, especially of local and small NGOs, and an increased role of subnational platforms. Challenges of remote coordination processes included, among others, overabundance of meetings and the loss of informal discussion and behind-the-door decision-making opportunities. Finally, the multiplication of coordination platforms outside and inside the cluster system was perceived as hindering coordination efforts and the efficiency of the response and highlighted difficulties of intersectoral coordination. Many participants mentioned the competition and duplication between government-led and cluster-led coordination platforms. The lack of clarity around mandates led to overlaps between different coordination platforms, such as RCC mechanism, WASH and health clusters, and so on. This was especially the case on cross-cutting issues such as hygiene promotion or washing infrastructure. Representatives of organizations participating in coordination mechanisms were overall satisfied with the support provided by the coordination mechanisms they joined. They felt coordination platforms were good forums to share experiences and findings and centralize guidelines, materials, discussion, and decisions. However, they felt that some areas could have been improved, such as intersectoral coordination and the formalization of lessons learned and successful innovations. By most organizations, coordination mechanisms were mainly used as a platform to find and gather information or technical guidelines. Platforms were beneficial to agree on standardized approaches and to avoid duplication. Yet, implementers would have expected more support in terms of resource mobilization, monitoring and evaluation, contingency planning, and emergency preparedness. Sharing the opinion of participants involved in managing coordination platforms, implementers highlighted the need for better coordination with other sectors, especially the health sector. Implementers felt that there often was redundancy with activities implemented by health partners, for instance, other NGO or governments. Implementer also highlighted the needs for stronger coordination of coordination mechanisms and the generalization of more integrated approaches to crisis. Overall, 4 main recommendations for the coordination of responses to future outbreaks can be formulated based on learnings of the COVID-19 pandemic. First, localizations still need to improve, notably by strengthening local coordination capacity of subnational clusters and local government. Second, intersectoral coordination needs to be strengthened. Coordination mechanisms should build upon the COVID-19 momentum to maintain and/or formalize intersectoral relationships to better prepare for future outbreaks. Third, there should be an effort to formalize cross-country and cross-setting learnings on what worked and what did not and why. This could be achieved through advocacy efforts toward a strong leadership on coordination at the international level. Finally, there should be more focus on processes that were neglected during the pandemic, such as monitoring and evaluation, contingency planning, and preparedness, which are all key elements of quality prevention programs. In terms of financing, it appeared that to reduce bureaucratic processes and disperse funds quickly, donor agencies channeled COVID-19 funding to existing projects and their trusted partners mainly. This was successful in supporting existing partners to adapt programs and to pivot towards COVID-19. However, it resulted in the funding of UN organizations and international NGOs mainly. There were few to non-open calls for programs, and unsolicited proposals were mostly refused. Many donors also put in place new funding processes to speed up funds allocation and reduce bureaucratic pressure on funding recipients. Several COVID-19 fast-tracked processes were put in place, and where possible, delays for turnaround proposals were decreased. Return reporting and monitoring requirements for implementing organizations were eased, often replaced by more regular, less constraining virtual meetings. Most donors perceived the pandemic as an opportunity to fund more hygiene response and research programs with the goal of gathering evidence around the impact of hygiene promotion. During the pandemic, evidence-based financing remained the key goal of most donors, which were sometimes torn between funding innovative hygiene promotion programs and only funding evidence-based activities. COVID-19 shed light on the importance of putting more funds toward all WASH activities, which was perceived as necessary, especially toward the achievement of the Sustainable Development Goals. Representatives of organizations receiving funding felt that there was a substantial inequity between large and small organizations in receiving funding. Where large NGOs were in capacity to use internal and emergency funding to respond quickly and felt that donors were flexible in pivoting funds or providing new funding, many small NGOs mentioned lack of funding as their main challenge during the pandemic. This hindered their capacity to deliver response programs. Funding for COVID-19 response programs was also received in waves, which had implications for implementation capacity. Funding was relatively low and slow to arrive at the start of the pandemic, which translated in the need to rely on internal funding or private existing funding if they were available. 6 to 8 months into the pandemic, funding increased for COVID-19 related activities before being replaced by more non-specific funding. Finally, development donors were perceived as quicker to respond to needs and more flexible in their approach than humanitarian donors. Finally, many implementers highlighted the key role played by donors in the type of program and activities implemented on the ground, and sometimes mentioned frictions on this issue. Organizations felt donors were sometimes reluctant in implementing new ideas or innovations despite the unprecedented context of COVID. Some funds were restricted to funding specific items which did not always align with guidelines. Despite the increased interest for hygiene promotion programs, implementers felt that funding was not easy to obtain for those activities. Overall, 3 main recommendations for the funding of responses to future outbreaks can be formulated based on learnings from the COVID-19 pandemic. As for coordination, there is a strong need for increased localization of funding. This could be achieved by advocating for and reinforcing funding mechanisms that allow for more direct engagement and resource allocation with local actors in alignment with the Grand Bargain's commitments. In parallel, and the following recommendation should not happen at the expense of localization and equitable funding, funds toward hygiene promotion initiatives should be sustained. Hygiene behavior are likely to be key in responding to future outbreaks, and evidence is needed to demonstrate the impact of hygiene programs. Efforts toward the simplification of bureaucratic processes should be maintained by, for instance, formalizing fast-track processes developed during the pandemic. If you would like more information and resources on coordination and financing during the pandemic, you can go to the COVID-19 Hygiene Hub website and read the learning brief that was written on this issue. Peer-reviewed journal articles formalizing this finding are also in progress. Thank you very much to you all for your attention.